My name is Ramon. I'm a 42-year-old infection control practitioner. I currently work at Gold Coast University Hospital and at Griffith University in Brisbane as Professor of Infection Control and Infectious Diseases. And I spend most of my time doing one of sort of three main things: working with students, teaching undergraduate students and postgraduate students in a range of areas including infection control. I practice clinically, so see patients and to manage infections in that space, and I conduct research in the area of infection control and infectious diseases, and I've done that now for close to 10 to 12 years. I'm the son of farmers, so I grew up in a little town called Marib, which is inland from Cairns. Marib is live, thriving rural town, and my parents were at that stage tobacco farmers. My interest in the health sciences and in healthcare really started in school. I was particularly interested in biology as a child, and also I had a strong interest in the health and well-being of individuals. In my high school years, I really wasn't sure what I was going to do in terms of study, but what I was clear about is I wanted to pursue a career in health. Towards the end of my high school years, I looked around the unis across Australia and indeed around the world and thought, where can I go to study public health and tropical medicine across Australia? And at that time, there was only really one standout institution, that was James Cook Uni. It had, at that stage, as it does now, an enormous global reputation in the area of public health, tropical medicine. Short of the London School of Tropical Medicine and Hygiene in the UK, it was the place to go across Australia. Living in Mareeba, which is a small town in North Queensland, which is a 4-hour drive away from Townsville, it was the ideal opportunity. And so I moved to James Cook University and began my undergraduate degree, which is a Bachelor of Science in Medical Physiology, and I loved it. In the second and third years of the degree, we really focused in on the core health sciences, and it was in third year in particular that I just absolutely shone. And we had, at that stage in the game, small classes of 9 or 10, and cutting-edge staff who are employed both by the university and the local hospital. And so we're really at the cut and thrust of everyday clinical practice in the area of health sciences and in particular public health. That was terrific for me. And then I moved into the postgraduate diploma of public health and tropical medicine, which was really what it was all about. And I had a ball. The opportunity to work with lecturing staff who were real-world experts from the WHO, come and run intensive classes with us, was just tremendous. And so that really spurred on my career to work in that particular space. After I graduated at James Cook, I did some work locally in the laboratory settings, and I soon realised that although I loved the science of medical microbiology, I really wasn't a great big fan of the lab itself. That is to say, 4 white walls and a whole bunch of machinery. And so it reminded me of the importance to really get into a setting where I wanted to work with patients in particular. So I moved fairly quickly into the ambulance service and worked with them for a good 10 years. And for much of that time, I worked in a variety of roles. The last 6 was Director of Education for the State for Ambulance Service, but I had a particular interest in infection control. And so I moved to Brisbane and spent the next 6 years as the State Director in Infection Control. It's all about the statement, there is no other James Cook University. I mean, if you look at the way it's configured, and I think the Vice-Chancellor, Sandra Hardings, needs to be commended because she's been able to brand and structure the university in a way that affords its place in the world. It has the reef on its door. It's placed structurally and physically in the tropics, and even down to how the colleges are arranged and the departments are arranged, and its explicit focus on tropics and tropical health and all things tropic-based. I mean, I've looked on as James Cook has evolved over the years since I've left. I left in 1994, and that's quite some time ago now. It now represents a place that is truly unique globally in that particular space. There are no other institutions that has the combination of its parts, and the sum of its parts equal what James Cook is all about.